Hello everyone, it's Dr. Durst with RevitalyzeMD, and today we're going to talk about hair restoration and one of our main and core procedures for that, which is PRF, hair restoration. So this is a live video of the procedure and we'll talk about what's going on as it's happening. So subscribe to our channel so that you can get more content like this with live videos. Okay, so let's talk about a PRF hair treatment. So what is PRF? Well, PRF is growth factors from your own blood that's going to help stimulate hair growth and to revive those hair follicles that might be inactive or in a resting phase. So here with our procedure, the first part of it is going to be us drawing your own blood. So that's a very comfortable in-office procedure to have done. And basically, we're going to draw off tubes of blood. And again, then we're going to process it to spin it down. And if you haven't heard of PRF before, PRF is, again, platelet-derived or blood-derived growth factors. And if you haven't heard of PRF, you might have heard of PRP. And PRP is just processed differently than PRF. Not many offices doing PRF. It's processed differently, so it has more good stuff in it that's released slower over time. So we spin this down to get the platelet-rich plasma, and with PRP, that's strictly what we get. We process this a little differently, so not only do we have platelets, but we have some white blood cells, other growth factors, mesenchymal stem cells, and all those good things that we can inject and get hair growth or revive of the hair follicle. Right here, what we're doing is a supraorbital block that helps to numb the forehead and the scalp. And then we also do a ring block around the area. So when they were injecting the forehead, that's, it causes a little swelling, but only lasts for a matter of minutes. But it'll numb the front part of the scalp. And then we do a ring block, which is what we're doing right here with lidocaine so that we can get the whole area numb. And again, hair growth or hair thinning is a big issue. It's pretty common, and also it's distressing for patients when they experience it because it affects our confidence, how we approach the world each day. And so regrowing hair without hair transplant, which is really expensive and also very time consuming, then, it's been a work in progress in how we can do that. And PRP historically has been one of the ways, but now PRF just allows us to process it differently. And we use no anticoagulant. Here's the actual tubes after they're spun. And so right there, we're drawing that top part off, and that's the PRF. And then it separates out from all the blood cells in the blood, and that's the darker part underneath. And so that's the cells and the blood. And so those are the red blood cells. We want to separate those out and get the plasma, but not just platelets, we want plasma. We want mesenchymal stem cells and some white blood cells because those all help stimulate the hair follicle and the stem cells to reactivate. So basically, then we're going to re-inject it into the scalp. And so that's what we're doing here. It's a very comfortable procedure once you're numb. What they're using is that device to cool when they're injecting it. And again, this patient doesn't necessarily have a lot of hair loss, but she has a little bit of thinning in the front, which is very common for women. So you can also do that once a year just to make sure that you don't have any progression of thinning early on. And there again, there's the PRF. And you can also, but commonly if you have hair thinning with men or for women, then we're going to do this in a series of treatments first. And then you can move to a maintenance once a year. And sometimes you're doing it until you're getting hair growth. But hair restoration procedures, again, take a little bit longer, maybe 6, 9, even 12 months to fully take effect. So it is a slower process. The hair follicle goes through growth spurts and it goes through a resting phase as well. And so we're basically trying to prolong the growth phase of the hair follicle and take it out of a resting phase. And that is what's happening with PRP or PRF treatments when we do it. We also have some laser treatments that we can augment with these PRF treatments. We can do some peptide treatments. We definitely recommend some oral supplements so the hair follicle is getting all the nutrients it needs, and you can also do some topical that helps with hair growth. So again, multiple modalities is really needed for hair growth because it's more difficult to do because the hair follicle does go through those resting phases. And the reason we do multiple treatments of this over months is because we want to get those hair follicles when they're in the active phase and to switch them out and then hit it the next month when they're in an active phase. So this is a very comfortable procedure. Again, once you've been blocked and numbed and then we use that cooling device, and again, just going to offices that have a lot of experience with it does help to make this procedure comfortable. PRF is the newest one, no anticoagulants with it, and so it basically is forming that clot once we inject it, and it releases the growth factors over a period of time, 7 to 10 days. And you have to process that PRF a special way, and so only certain offices are doing it, but it definitely is producing more results than the PRP treatments that we did. We absolutely love it. We use it for eyes. We use it for all kinds of other procedures, hair restoration, facial PRF treatments. So thank you for watching the entire video. Again, that was a live video of a PRF hair restoration treatment. And again, like, subscribe, help us get content out there, and let us know if there's anything else you want to hear about. So we're here to revitalize your look, your health, and your sex life.